So what is neuroplasticity? I recently just had a patient come in. I'm another functional neurologist here in Denver. I'm not going to name names. However, this patient came to us saying that this person told her that she has no neuroplasticity left, and this is why she's been spiraling and creating panic and fear and all this other issue in her life. This was following a concussion, this was following a motor vehicle accident, and a sudden flare of intensity of symptoms like depression, ADHD, sleepless nights, anxiety, and fear. And unfortunately, in pop medicine, what we're seeing a lot is this oversimplification of medical practices that, when oversimplified, become just downright wrong. So there's no such thing as having or not having neuroplasticity, right? This isn't something that we can obtain and get, right? It's not an on or an off switch. Neuroplasticity is a phenomenon that just happens, right? Your brain has the capacity to change based on the environment that we live in and the focus that we give it, right? It has a lot to do with neurotransmitters like dopamine and acetylcholine and what's called BDNF. However, your body will make these things. Even if you're nutrient deficient, if your gut's not functioning properly, if you do have a brain injury or concussion creating inflammation and neurochemical imbalances, those can absolutely alter neuroplasticity and maybe the capacity of which it's done, or maybe where your focus is able to stay focused, right? Because the brain changes based on what it's focusing on. You can have no neurochemicals, or you can have an imbalance in neurochemicals. You can have a very poor gut. You can have a very poor health and lifestyle as a whole, and your brain will still change. You will still undergo neuroplasticity. And in fact, what this particular patient, what this lady was experiencing, is neuroplasticity. And the fact that this individual said that she has none discounts the fact that neuroplasticity can also be maladaptive or create bad neuronal connections and communications and things that fire together, wire together. Right? Her brain is creating a neuroplastic connection of fear, panic, anxiety, and depression and ADHD. This spiral is unfortunately a bad case of neuroplasticity, right? This isn't the absence of it. It's just if you spend focus on pain, or you spend focus on being dysregulated, or spend focus on how miserable you are, that will happen more, right? Your brain is focused on it. Your neuroplasticity will drive into that direction. We just need to enhance neuroplasticity and give it the direction that we want it to go in, right? So that's what we do. We don't turn neuroplasticity on or off. We encourage it and we enhance it in a direction that we want it to go into by changing where their focus is, by changing the fun that we're having, by implementing some frustration and challenge in your life, and ultimately creating a frequency of habits that happen on a consistent basis, because what you're focused on needs to happen consistently for it to be making changes. So there is no such thing as no neuroplasticity. Neuroplasticity is not an on or an off switch. It is not even necessarily a scalability of potential as much as it is just a phenomenon, right? We can coax it and manipulate it and push it and drive it, steer it into the direction that we want it to go into, but the brain will always be adapting, regardless of what nutrient status looks like, gut health, toxins, anything like that. The brain will always adapt to what it thinks it needs to do to best live your life. If somebody is in your corner telling you you have no neuroplasticity, look somewhere else. I'm sorry. If you want to try to realign some of your focus and purpose and steer this neuroplasticity in a direction you would like it to go in, give us a call. You can reach us out at the clinic, and we can get you started being a new patient and figuring out best how we can optimize your nervous system, your body and metabolics, and your mental health here at Axon. So if you're tired of dealing with chronic pain or stress or anxiety or trouble sleeping or anything else that you feel like your brain has helped put you into, we can steer that out of there. Give us a call, reach out to us here at Axon, and we can certainly get you started on feeling better and living a life that you want to live.